What is the best type of facelift? Essentially, there is no one best type of facelift. So when you've heard some of the prior talks, I'm sure you may have taken home this point that the deep plane facelift has the most amount of lift, so therefore I want that because it has the most amount of lift. This is not technically the way we need to look at this. The way we look at this is that the facelift, or the actual surgical procedure, is tailored to the patient's needs. If the patient has aging primarily along jawline and neck, they're not going to need as much work up here. Now, if a patient has significant aging in all three, then you have to address all three of those target vectors. So the way I look at this is that there is no one type of perfect facelift for every patient. When I actually look at my work in the operating room, that surgical procedure is essentially tailored for that patient. Twins probably are not going to get the exact same facelift because their anatomy is going to be slightly different. So the simplification of a mini lift versus deep plane is really an oversimplification just for conversation purposes so that we can talk about it. However, in essence, there is no perfect facelift for every patient. It's a custom tailored approach, and this is my personal philosophy that we have to find the perfect surgical procedure for the individual patient, the individual patient's needs, the individual patient's wants, and the individual patient's anatomy. So we take all that together and then figure out what type of lift is going to best satisfy our needs and wants.